In late October, we found out the Oklahoma State Department of Health was in a financial jam with a $30 million budget gap. The department had overspent for years, and it ran out of ways to shift money around to cover the problem. The situation raised two major questions. How did this happen, and what will the health department's future look like? Documents and former employees give us a pretty good idea of how they got here, but where they're going is still a mystery. The situation may have seemed sudden to the public, but top officials had warnings since at least June last year, and documents suggest they may have known as far back as January 2016. The obvious question is why no one did anything about it. Any answer is somewhat speculative, since top officials won't discuss the situation, but former employees say the people at the top never seemed to quite believe what the numbers were telling them. By October, the problem was too big to ignore, though. Top health department officials, including Commissioner Terry Klein, resigned, and the Board of Health fired a few more. More than 100 health department employees, mostly working in county health departments, were laid off. Lawmakers had to give $30 million to stabilize the department. There are still quite a few questions about what will happen next. Tom Bates, the new interim health commissioner, says the finance team is still sorting out where all the money went. The department also needs to figure out what offices need more people and which could do their jobs with fewer, Bates said. The problem of moving forward is even more complicated because it's not clear what the health department's budget will look like. A corrective action plan the department submitted in January said it could cut its budget by as much as 1/3. The legislature had asked for a 15% cut late last year, but there's no telling what level of fund lawmakers may actually approve. Keep following The Oklahoman and newsok.com as this story develops.